Yeah, I think they added an extra.
Well, I can tell you you lost your voice. You better watch the visual live.
That's why they're like.
That's right.
Yeah.
You only sick as well?
Manufacturing standardization.
Apparently.
How are you?
That's probably like if both of you get sick at the same time, it wasn't help at the same time. Somebody gets sick, and the other one hang around, hang around, and
Good to
you're
go.
okay, and then he starts, and he kicks off. And that's what
All right.
happens a lot. They spend
Way to
like
earn your payday.
10 days, both sick.
So I followed the instructions Drew had texted me to start the laptop. It should automatically start broadcast.
I don't see the recording.
I tried texting
Hi, how are
my
you?
voice.
How are you? Good?
Yeah.
We got to get that worked out by next week, because I want to have it print out the way.
Cozy in here today, isn't it?
Yeah, I'm not sure what's going
It's
on.
really quiet outside too. I don't know, just the city. I'm like,
Together
every time that
You're
happens, I
really
walk
quiet.
in and I'm like, is there a conference? It's really exciting. Like that total like
I've done that before.
disorientation.
Showed up
Like,
at a holiday.
yeah, it's it. Oh, really?
Yeah.
Good, he's getting fit.
That's right.
We went to the chat.
Yeah, I think you can just plug that in here.
You have a mouse ready?
Yeah. Frank's gonna check to see if it's.
Oh, no.
Oh, I can.
You want to see if we're broadcasting?
Yeah.
It's terrible when phone jokes. Everyone thinks you're Yeah, yeah, I know.
The morning routine the same for
Oh
every
yeah,
separate
exactly.
project.
Yeah, exactly.
I don't know the average because
I can do it, yeah.
From Everett, it's an hour north. That's tough.
I don't. The red lights
I mean,
on.
you can't go to the children, you know that.
Yeah, I was gonna say.
Yeah, children clinic doesn't allow sick people to wander around. It's not like adults.
Where do you have to be? Where do you have to be?
Immunodeficiency clinic,
Oh.
you know?
Yeah.
Yeah, you gotta call it off. You gotta call sick.
Well, that only
You gotta call sick. You can't do it.
Yeah.
I mean,
Let them know.
if my child has possible immunodeficiency,
I would not want them to
and I
see you.
don't want them to be seen by you.
Who else is in the country?
I mean, that,
Oh, yeah.
I will be stuck. I mean, I mean, what you got, you have to do it.
If you call it that voice,
Nobody will say no to you. It's like,
stay home. Yeah. You'll be fine.
Allergen.
it's like you're taking, it's like you're taking to Hawaii.
Yeah,
Well,
exactly.
I see I don't have the Silverlight software to actually pull it up, but there's a red dot in the corner, so that's, I think that means it's.
I mean, you gotta call her now because before you lose your voice and you can't even call her like that.
Broader selection of sandwiches now.
They want sandwiches. I know that.
They do more?
Yeah.
No.
This is the regular
I got stuck with oatmeal.
You're ready anytime.
Yes, anytime you're ready.
Okay.
I know there would be sandwiches.
Yeah.
So it's easy to get themselves.
I appreciate that. Let's see what
Yeah,
you
no
have.
problem.
Room at the end down there?
Yeah.
Oh, Jay went to move his car, but we did.
Oh, they're service.
Yeah, but you didn't have this silver one. What's this one?
Is it just like a plug-in? That makes it work.
All right.
Is it in there?
All right. Thanks.
Yeah. Microsoft.
Is that true?
Yeah.
Oh, then you're gonna hear what I was gonna say. All right, well, let's go ahead and get started. The word of the day is allergen.
Yeah.
I wish Drew wasn't listening. Maybe he's not going to hear me. It was a bit of a rough morning here with both catering and AP. So I've come to realize how invaluable Drew is. In case he didn't hear that, don't tell him when he gets back. He's in Hawaii. Hopefully we're broadcasting and recording this. Dr. Derek Constable from, I still call it HollisterStier. Is that still the name of your company?
That's fine. It
Yeah.
has a longer one now, but people know it's a HollisterStier.
I mean, this is the bread and butter of what we do every day, right? We use allergenic extracts to seed test people and to put them on immunotherapy. And we just take it for granted. Many of us don't know anything about the manufacture, preparation, standardization of the product that is the underpinning of our entire specialty of medicine. So we don't do this presentation often enough, and I really thank you for coming and educating on this. So this will be on the manufacture and standardization of allergen extracts. One other comment, unrelated, but for those going to the Quad AI meeting, which is quite soon, on March 4th, so that's a Sunday, at 6:30, we're going to have a social function, get-together for everybody at the university, all our former fellows, everybody from the Pacific Northwest. So if you're going to the meeting and you haven't signed up yet, please do so. I made arrangements and we'll send out where and when. So again, thank you for coming.
Dr. Altman, ladies and gentlemen, thank you very much for the invitation. It'll give you an opportunity to show some of the work that we've been doing over the last, well, for me personally, nearly 40 years, both in the United States and in Europe, where I originally started with the allergen extract business. So what I'm going to go through is primarily just an overview of my disclosure. I'm a full-time employee of Jubilant HollisterStier. I've got no other relevant disclosures for this presentation. I'm going to go through basically the three grouping or sections of manufacturing: the raw material and how we process that, then moving into how we extract the allergens from that raw material, all the way through to a fill finish, which is the final product that you will see that companies like ourselves will deliver to your centers, as well as then the final test and release of such finished products. And I'll concentrate there on some of the standardized products that we produce because it's more interesting to talk about. So, raw material and processing. As you probably know, we collect and we process a wide range of materials, almost from every corner of the environment that we're collecting these materials in order to process them through. And the four I'm going to sort of concentrate on this today are our pollens, our venom products, our house dust mites, and hair and dandruff. So as far as the pollens are concerned, these come from the natural environment. We go out and collect these materials. They're not like classical drugs, which are synthesized in a laboratory to produce them to a high degree of purity. We have to go out, collect these materials from fields, streams, trees, wherever that they appear. and or we will cultivate them under controlled conditions if collection from the field is not possible. And I'll go through some examples of some of these things. Once we get these materials, they've got to be first cleaned and dried. So we can extract we can remove the important parts, pollens from plant parts, for example. And then we're required to, by FDA and QA, quality assurance guidelines, we're required to make sure that they're of a high enough purity before we can move them through to the processing. For example, in a pollen, we can't have more than 1% foreign material. By foreign material, I mean plant parts that have been left over from the cleaning process. And identity clearly is an important aspect. A lot of these pollens, to me, even me after 40 years, look very similar, even under a microscope. So we need a trained botanist in order to identify, confirm their species, so that they can be correctly processed through the remaining chain. As you know, pollens in particular, they only appear in the environment at particular times of the year. So we have to go out and collect them, know where they're pollinating, know when they're pollinating, and be there ready when they pollinate. Otherwise, if you miss them, it could be a year before you can collect some more materials. And that can be critical and disastrous in many cases. We can't always rely on the weather. That changes and will shift the pollination seasons. We even have disaster areas, for example, flooding and storms that wipe out a year's collecting for particular materials. Some trees, for example, just refuse to pollinate. We had one, American beech that throughout the United States didn't pollinate for almost 10 years. And we went into a serious backorder situation because of that, but there's nothing we could do about it. Fortunately, it started pollinating again, and we could then continue to collect. But you can see, depending on the species that we're collecting, and obviously some of these don't apply to this particular area, but you can see where the pollination occurs, and therefore we have crews out pretty well throughout the entire year collecting these materials. Collection is a number of different techniques. We can either basically vacuum the material up. So you find a stand of grasses or trees. You go with these sort of large vacuum materials that just basically suck the pollen up just as it starts to pollinate. I don't know if you see on the highways these trucks during the snow season waiting on the side for the snow to fall, and when it falls, off they go. Well, it's a bit like the pollen. They sit there on the side of these big fields of grass waiting for the pollination to start, and then they rush through to collect the pollen because they have a very short period in which to do this before the wind takes the pollen away and you've lost the harvest. One way of getting around this is that they will, particularly with trees, they will actually pick the stamens or the catkins, for example, just before they pollinate. And then they can be brought inside that greenhouse where they're allowed to pollinate. I've got an example of that.
Do you just use natural growth, or do you plant your own fields so you have unique?
We used to do a lot of that at one time. Our company used to own a farm down in the Willamette Valley at one point. But the economics of the farming versus going out and knowing where these things are cultivating became a lot easier to do. We could gather from a larger area. So we don't do that as much anymore. We used to, for example, and other companies will do this, will plant rows of Timothy grass, for example, and then go through and vacuum it all up. We know where particular stands of particular trees are, which we will go out year after year and collect the pollen from. Where we have some issues, we will actually go out and harvest the plants, as I mentioned earlier, bring them into the warehouse and set them in buckets of water, basically, so that they're hanging over the edge, and you can see then allowed to dry and pollinate naturally, and because there's no wind, they just fall down, and they can be collected on this white paper as our first section. And this, I think, actually is a Timothy hay grass that's been basically cut by hand, brought in, dried. The second process is as I mentioned before, is the drying and processing of these materials. We have a pollen facility in Spokane, and it's very similar to other companies, where we have lots of individual rooms, where one species goes into the room, so there's no chances of contamination. When we finish processing that, they will be totally cleaned. We control the heat, the humidity, the temperature of those materials to dry out those materials on trays, at which time we can then separate one from the other. They're obviously all cleanable surfaces, no textures, so things can't get caught into parts of the wall or the ceiling or the floors. And we obviously clean, as I mentioned before, between each one. For example, with some tree stamens that we've collected, we let them dry, and then we remove the plant parts and leave the pollen in a semi-cleaned process on the paper. We will then complete the final cleaning by using a vortexing piece of equipment. This is basically a design where you're blowing and cycling air in a vortexer, which then separates by particle density. And you finish up with pollen coming out that is 99% higher purity, and the waste parts are discarded in another angle. That begins that first process of bringing us to the more material. Venoms. This is another area. Of the companies that produce venoms, they primarily produce honeybee and then the vespids. With the honeybee, this is actually very simple to collect. What they actually do is they put in an electrical grid that stands in front of the hive. So when the bees come in to enter the hive, they have to walk over this grid. It's a very mild electrical current that goes through, and it involuntarily makes them sting and release their venom. And what happens is that the drop of venom passes underneath the grid onto a glass plate. That plate is then removed after a day or so, dried, and then you can scrape up the venom, and it's 100% pure venom. There's no contamination in it. The insects are unharmed, they fly off again, and it produces like a little crystal. So this is the closest to a pure material that you can actually weigh out and process forward. Wasps and venom are a different animal. You can't do this with them. If you try and do it, what happens is they defecate all over it, they contaminate the material. So what we have to do, we have a collector network throughout the entire United States that are collecting nests. They take from the nests the insects. They're looking primarily for female insects. We have a requirement that we can't accept anything that's more than 5% males. Males don't have stingers, therefore they don't produce venom. So it's the female workers that we require. Sorry, ladies, but they have to freeze these insects, whole insects, at the time of collection because the venom spoils very quickly. And then they're shipped to us as a frozen bodies. As we then have to individually dissect these insects. And this is just an example of the crew who are dissecting these insects, one insect at a time. And what they do is they pick one up, they squeeze slightly on the abdomen to expose the stinging apparatus, which is then removed. These insects, by the way, are dead at this time, or frozen. And then those sacs are then placed into a vial of extract fluid. That fluid is then processed forward. We need about 10 or 30 insects, basically, have to be dissected in this manner to produce 100 microgram dose of venom that you would use for maintenance therapy. And this happens with all basically the Polystes, the paper wasps, the yellow jackets, and the hornets that we produce for products.
Do you fire ant also?
We do fire ant, but we don't dissect those. They are basically processed as a whole body. But when you try and work out the amount of venom, those little insects, probably 50% of their weight is close to pure venom. They're just basically a venom holding receptacle. And we worked out roughly that a 1 in 10 weight volume extract of fire ant bodies yields something very close to about a solution of 0.5, a 1 in 10 dilution of that, 0.5 mil, is somewhere in the region of about 100 micrograms of venom. So you can see the amount of venom that these insects contain. And though it's not as pure as the flying insects that we produce here, it's pretty well very close to pure venom at the end of the day. And you get very good, evidence has been a very good therapy from that.
No one any longer makes whole body extract of bees
No,
and wasps.
no, nobody does that anymore.
Yeah. Our young people here don't know, but there was a long-running battle with old-time allergists, much older than me, who believed that whole body extract, that's the way we used to immunize people, with whole body extract of bee, wasp, and vespids, and they believed it was efficacious. And I don't know, 20 years ago, was it, that there was sort of open warfare at our meeting between people who didn't want that product taken off the market versus what we do now. And it ultimately took a complex study to prove there was no efficacy in whole body extract of anything other than fire ant. But that was the norm for a long time, and how you treated people for venom immunotherapy was whole body extract of just a historical vignette.
I think they did discover a few isolated cases where beekeepers, for example, were responding to some of the non-venom body parts, but that's because they're exposed to these insects 100% of the year, and they were breathing in the dust being created.
Is the venom shortage over, or is there still a venom shortage for the bees?
There are plenty of insects out there. It's the collecting that's been an issue. As you know, we've had an issue with supply from all the companies, and we've been ramping up production to try and compensate for some of that. But like the pollens, these insects are only available at certain times of the year. And again, if you miss that collection, you've got to wait for a full year cycle before you can have another attack at it. We had an example, for example, in Florida with extreme flooding. And there's a particular species of yellow jacket down there, the Vespula squamosa, that was totally wiped out because they're ground breeding insects. Their nests got drowned and wiped out, and we missed a complete year's season of that and had some trouble. So we've modified our collection strategy to make sure that we have a good inventory that would last us for 1 to 2 years. But when something happens and you're having to ramp up production to supply, double the supply basically, our economics and our inventories aren't capable of supporting that. So it can take almost a year for us to get up to the supply to cover those deficiencies at this point. And that's where we found ourselves very suddenly, what was it, about 6 months ago? And but the industry, the profession has responded very well in modifying some of their practices to minimize the usage while we get up to adequate supply chains, but it is improving. So I'm hoping you're seeing it at your end, but I appreciate there's going to be some difficulties with some species. House dust mites, these are the critters that run around in your couches, in your beds, and are very important because of their implications with asthma in longer term exposure. These are ones we don't go out to houses and collect anymore. They used to at one time, but now we cultivate them in-house. And all the other companies will do exactly the same. They basically have controlled temperature, humidity chambers in which they will feed these mites on a medium. We basically inoculate a medium with the insects, which they will then flourish under the environment. We can then isolate the insects, the whole body insects, from that medium, and then we have a continuous. We use some of that to re-inoculate going forward, other culture batches, and then collect these materials. And at the end of the day, we finish up with this sort of grey, I'm partly colourblind, so it may not be grey, but it always looks grey to me. It's sort of very light, but they're 100% full body insects. And again, like the pollens, we will sieve them, we will clean them up to make sure there's less than 1% carryover, mainly spent medium, the food that they've been feeding on.
Are they actually insects? Someone told me they're not insects.
They're not really insects. I sort of generically call them insects, but they're more related to spiders and the mites and these little parasitic type insects. But they typically feed in the wild on human skin scales that we shed all the time. We don't use those for our medium, I can tell you. I can't tell you exactly what we use as a proprietary issue, but it's a well-controlled material that we know we can remove and has, to our knowledge and from our studies, no allergenic or antigenic properties that can be carried over into the material. The simplest thing with hair and dander is basically we collect hair and dander from animals. And that's done through a certified veterinarian who will attest to the health of the animals. And then they're clipped. So they're coming through a professional organization. So we know they're healthy. We know what they are, what animals they are. It's not like we're going around to poodle parlors and collecting the scrapings off the floor. These are collected in a controlled manner. And it takes a lot of hair to produce. That's why we have them in buckets. I mean, we have kilograms of pounds and pounds of hair that comes in. We don't have any particular restriction on which breed goes into the mixes. All breeds produce the same allergens, just in different proportions. The only control we have is we don't like more than 25% of any one breed in there, because that affects the lot-to-lot variability if you try and you're too biased on one species. By mixing the species, we get a more consistent product at the end of the day. The hair is inspected as it comes in, despite coming through a veterinarian. We do check that the hair is consistent with the species that it's labelled as, and also that there's no foreign matter. And when you look at the behaviour of dogs and cats, you can understand some of the things that we're concerned about not getting into the final product.
The comment there, no breed-specific allergens, leads to the question about hypoallergenic animals.
Yeah, and I'm not a great believer in that. It's just that they don't produce a lot of allergen.
So, I mean, our patients are after that piece of information and find it on the internet, and you put any stock in that there's anything hypoallergenic?
Not really. Every dog, every cat, if it's producing, if it behaves naturally. For example, cats. The main allergen of cats isn't actually on the hair itself; it's from the saliva. And cats naturally lick themselves. The saliva dries on the hairs. That becomes airborne, and that's what the patients largely are sensitive to. They are sensitive to other allergens, but 90% of them are going to be sensitive to these saliva. Dogs, again, most of it is coming from dried skin scales, and every dog will shed skin. And so the trouble is with not the trouble, but the issue where this hyperallergenic situation comes in is the short hair breeds, or even the nude breeds. The hair, the scales will instantly fall off. They're not being retained by the hair. So you have a very low allergenic exposure over a period of time, which gives the impression of being hypoallergenic. I'm sure there are people out there who will argue against that, but this has been my experience. So, and when they talk about this dog is less allergenic than that dog, when you look at their particular production of allergen, it's just the quantity. Long-haired species will retain more allergen in the hair and therefore usually have more problems. Short-hair species, it gets dispersed more rapidly and therefore they don't have an issue when they're handling the animals as much. But there's only different. But breed-specific allergens, in my opinion, doesn't exist. There's been no evidence to suggest that that's the case.
Does anybody tell patients anything different? That's what I tell patients, is there's no real hypoallergenic. And I assume even short-haired animals, so the allergen falls off into the carpet and the sofa, it's still retained in the household.
It's still there.
Yeah.
It's just that most of the problem occurs, a lot of the problem occurs when people are picking them up, kissing the animals or stroking them, and then creating the dust that's coming up that's causing a lot of the problems.
You know, people kiss their dogs more than they do their spouses. Especially the longer you've been married.
And probably some of the best evidence, they put people in blinded environmental chambers, and it doesn't make any difference what dog you put in there if they're dog allergic.
So once we've collected these materials, we then move on to the actual manufacturing process, where we're initially extracting and processing those materials through to a final product. This is just a quick overview. There's sort of 3 phases I like to split it into. There's the extraction phase, where we're taking the raw material, we're combining it with a liquid to extract it. We then separate the insoluble materials from the liquid and recover that bulk extract. Those bulk extracts can then either be processed further into some intermediate phase, whether we dialyze the extract, whether we precipitate the extract, and again, but it still ultimately gets down to a bulk material that we would further process. A lot of the extracts will go straight to vial, and by that means is that we do the extraction, we clarify it, and then we fill it directly into the finished product. These products are sterile filtered, they're filled, they're stoppered and oversealed, and then they're labeled, tested and released, and then sent out to you. Some of them we do additional processes on in terms of characterization. These are the standardized extracts that we will produce. At every point in the process, you'll have quality and environmental checks. And I'm sure you've seen pictures of people in filling rooms who are gowned up in what we call bunny suits. They're standing there with their hands out, so they're not touching anything. And every time they come out of the room, we take swabs from them to make sure that there's no bacterial contamination. If they fail, I think 2 or 3 times in a row, they're then taken out of the process entirely and have to go through retraining again on handling. Most of the problem is when they're gowning up is keeping their hands away from the outside so they don't transfer their body flora to those garments, which can then shed off in the filling rooms and get into the product. So as far as the extraction, you can look at 3 different phases within that. There's the release of the allergen from the raw material. And most of these just rely on a passive extraction. For example, you just put pollens or epithelials with the liquid, you then stir it for a period of time, The allergens are released through, particularly with pollens, are released through the germination pores. So you get this simulation of a pollen landing on a nasal surface, and then the proteins leaching out, which are causing the problems. With the hair, it's basically the dander or the dried saliva on the hairs, which is flushed off or dissolved as part of the processing. Other materials such as mites and venoms, because of the nature of the venom sacs that we've just dissected and you saw earlier, we have to split these open in order to release the allergens. With house dust mites, we were actually ball milled these in a jar with ceramic balls in order to break open the very hard cuticle and release the allergens. With the venom sacs, we use basically a homogenizer that would then gently split open the sacs to release the venom. The extraction fluids is very important in terms of what we're using. We want to try and enhance the stability of the extracts we're extracting. As soon as they get into a natural environment, liquid environment, they can start to degrade. And so we tend to use, most of our extracts we will extract into 50% glycerol. The 50% glycerol basically coats the proteins, it reduces the surface-bound water and creates an improved stabilization of the conformation, so it's not unraveling as easily. The downside with the 50% glycerin is that it can be somewhat painful to inject, although it's not impossible, and I get different stories from whoever I'm talking to as to the issues with that. We do produce extracts with non-glycerol fluids, but the disadvantage of these is that they aren't as stable. They don't last as long in that environment. We do sometimes use 0.03% human serum albumin, our ABS, that helps enhance the stability of the proteins. But it's only really successful in diluted extracts. It basically coats the glass surfaces to prevent absorption of diluted allergens to the glass. And it does help a little bit with the stability, because it bunches around the protein, so to speak, and helps retain their conformation. So stability is very important. Bacterial protection, as soon as you take it out, there's always a chance of bacteria. You've got to imagine, for example, dog hair. It is full of bacteria. I mean, you put it on a plate and it's totally overgrown in a few minutes, in a few days. So we have to put something in there to control it. The good thing about glycerol is it's a bacteriostatic material. Not only is it a good stabilizer, but it will prevent bacteria from proliferating. It also has a mild bactericidal effect, so it will, over a period of time, reduce and kill the bacteria in that solution. And that's really to protect that extract between the point of extraction to the point that you would do the sterile filtration, which would take out all those bacteria. So you want to protect it so the bioburden doesn't increase to dangerous points of levels. And so that's important. If we're not using glycerol, the only one that was currently approved for allergen extracts is phenol. And we will use phenol in our purely aqueous extraction processes, the ones that don't contain glycerol. Although phenol is very safe, it has a deleterious effect on proteins, especially in the diluted format. It can denature them, and so you've got to have a good balance. We sometimes add ABS, the human serum albumin, as I mentioned, which does help protect it to some degree, but it's not perfect. And you will see it, if you looked at two different slopes of the stability, you will always see the aqueous, even with ABS, going down faster than you would the glycerol. So just a point when you're ordering and you're deciding on what medium to use or product to use. The second stage is really the clarification, and depending on the nature of the material, it depends what we're going to use. For example, we can use a simple Buckner flask with Watman paper to separate very coarse material like pollen, for example, from the liquid. We just pour it through. It's a very quick process. This liquid coming out is still pretty particulated. So eventually we put them through depth filters, and this is an example of one. We have multiple areas, so a large surface area, which takes down a lot of the particles of the material. It's not sterile, but it just takes that material out. We then put it through a final clarification filter, which takes out the extremely small parts. And there's an example of a tube type one there, which will take it down. We remove everything from below 0.8 to 0.2 micron particles. But even at this stage, we're not sterile. Intermediates. There are different ways that we can look at this. Sometimes it's desirable to remove small molecular weight materials. We can use tangential flow filtration, which is basically dialysis. And where you're doing this is you're passing the liquid very rapidly over a membrane surface and continually cycling over this surface. The reason for doing that is you don't get any build-up of debris on the surface and blocking the pores. But what happens is that the small molecular weight particles will pass through the membrane and be discarded, and therefore you retain a cleaner version of the allergens within that retentate pore. And that can then go on to further processing. This is just an example of a piece of equipment that will do this type of work for us. The other way is precipitation. We have a couple of products where we would try and precipitate the allergens. It then comes out as a very concentrated format that is used for then preparing the dilutions and concentrations that we need in the final product. The material that's precipitated can be dried, and it'll finish up as a powder or particulate material, which we can store as a raw material for final processing later. And this works particularly well with hair and dander type materials, which otherwise can be very dilute. Field product is basically the same in any pharmaceutical industry. We have clean rooms. We will sterile filter the product into a clean room environment. ISO 5 class 100 conditions. This means that you're having less than, I think it's 100 particulates per cubic meter per hour passing through, very fine. It's not quite as good, the industry standard is not quite as good as semiconductor clean rooms, which go down another class, because that has an even worse impact on the product than the pharmaceuticals. But these are the normal standards you'll find in any pharmaceutical industry when you're filling final liquid product. We use high-speed fill lines as the example in the first illustration, where we're passing vials through and they're automatically delivering a fixed volume into each vial. That will then go into a stoppering and oversealing process. So you can see the operator there standing with his gown up, with his hands in the air, and he's making sure he's watching. He'll only intercede in there if there's a blockage or one of the vials falls over, for example. They will then go in with tongs to set it back up. They can't lean over it because of the problems of particles dropping. And some of these products, particularly the venoms, will then go into lyophilizers and be freeze-dried and then stop it within the environment of a sterile lyophilizer.
Is this entire process you've taken us through, is this all done in Spokane?
Yes.
Is that the only site in the U.S. where you manufacture?
Our company, yes, our only manufacturing site in the United States, yes.
How many companies make allergenic extracts in the U.S.?
There are the three major companies are ourselves, AOK, Avio, and Greer, Allergen Greer now. But both of those are on the East Coast. We're the only one on the West Coast. And I still think it's true that we're the only pharmaceutical manufacturer in the state of Washington. Everything else is research or small-scale work, not final product. Our primary aim is manufacturing. And If you go down south a little further into California, you'll find loads of them there. But in Washington State, we're probably about the only manufacturer of pharmaceutical biological products in the state. A little unique there. But yes, we do all these processes in there. We have 2 high-speed fill lines. A lot of the material is also manually filled, and it's not like a pipette in a lab where you suck up 10 mils and then deposit it. These are like automated fillers, but you hold it and go through. We can fill up to about 1,500 vials as a typical batch. Most allergen extracts are filled in small batches. It's not like with producing 20,000 vials in a run. We do for some of our diluent products because we need a large number of the same material. It's economical to put them on a fill line. But for these small batches, the setup costs and wastage is far too much, particularly with the venoms where it's so expensive that you want to keep every vial possible going forward. So we tend to use manual fills for those. Test and release of the finished product. I'm not sure how well I'm doing on time at the moment.
About 16, 17
Oh,
minutes.
okay, let's find it. We obviously have 2 classes of products. One we call non-standardized extracts, and the other one are standardized extracts. The non-standardized, typically the finished product will go through sterility testing, safety testing, appearance, protein content, fairly basic characteristics of the material, but required by the FDA CFRs for us to do this on every single batch going through. At one time we used to produce custom prescriptions. We don't anymore because of the pharmacy laws have changed. But with those, every single vial that we produced had to be sterility tested. Every vial. With batches, you do a sampling through the system and pull out several vials which you would test for sterility. The CPPs, our custom patient prescriptions, used to be every single vial. So it was an enormous undertaking at that point. With standardized extracts, we have an additional test on top, which is a potency-related test. These are tests that are mandated by the FDA, and we have to apply and to every lot going through, and has to meet particular criteria that the FDA tells us. As you can see, the range of standardized products are fairly limited, though. By the way, this standardized program is purely dictated to by FDA. They set up the systems, they tell us which ones we have to standardize, they supply us with the materials, and we do the work basically on this. So for the moment, the standardized range that the FDA has under their control are the cat products, cat hair products, short ragweed, the 2 house dust mites that we produce, D. farina and D. terranucinus. Then all the grasses, standardized grasses. There are, I keep adding them up, but about 8 grasses, 2, 4, 6, 8 grasses, standardized grasses. And then, of course, all the venoms that we will produce. There's about 200 allergen extracts that are still available on the market today that have no US standard of potency. They keep talking about getting around to it, but yet they've not done any more at this stage. And they are probably the bulk of the materials that you would actually handle. So they're labeled in terms of weight volumes, very simple basics, and they're defined by the method of manufacture. So that product is defined. That's why sometimes it's a little difficult to shift from one company to another, because there's little nuances, let's say, in the particular manufacturing processes that requires. That's why we always put in like a 50% cutback, just to make absolutely sure you're not going to run into any problems if you switch and change of those materials.
You said the FDA provides the standard that you have to match. Where do they get their standard?
They get their standards. What they do is they put out bids to the companies. The companies will select and provide the FDA with samples of particular batches. The FDA would then evaluate those ones and then pick one that they're going to use as a standard. They will then prepare that material, they will dispense it into vials, they will seal it, label it, characterize it, then send it out to the industry for all of us to look at, and then make sure that we're comfortable with the responses that we're getting. And we have had issues where what the FDA said it was going to do, we can't reproduce in the lab. And then we as an organisation, the Allergen Manufacturers Association, will consider the information, get back to the FDA and say whether or not it's acceptable to us. So, and sometimes we get overridden. They will override our opinion and say, no, you've got to use it. Or they will actually remove it and prepare another standard. So the types of tests that the FDA gives us, there are two major ones. There's one for measuring major allergen content, that only, and usually it's, at the moment it's a radial immunodiffusion. I'll show you what these tests are later on. But it only applies to our cat product and our short ragweed product, where we're measuring the two major allergens, FeLD1 from the cat, which is the salivary allergen, and then the AMB1, which is the major allergen in the short ragweed. We also do an RID, it's sort of an immunodiffusion assay, but it's actually looking for enzymic activity for the venoms, where we're looking for phospholipase activity and hyaluronidase activity, and it's standardized based on the consistency of that in 100 micrograms. The other ones, the grasses, the cats, and the mice, they use an inhibition ELISA testing, which is basically a 96-well type format where you're looking at inhibition reactions. And again, I'll go into the details of these in a moment. The RID is a very simple process. Basically, you've got an antibody or a substrate that you put in an agar gel, you cut holes in it, and then you put a serial dilution of the standards in a set of holes, which are the FDA standards, so you develop a calibration curve, and then the samples that you're looking at. So what you see is that as you put the liquid in the well, it will then diffuse into the gel. It will either create a precipitate from an antibody-antigen reaction, that's the radius of which is dependent on the concentration. And so you can construct these straight line graphs, then look to where your product falls on it, and then read off the concentration from it. And the same with the venom. Instead of an antibody reaction, you're looking at the enzymes in there digesting a particular substrate. So you get a zone of clearance that occurs. And then you can measure the radius, which is directly proportional to the concentration. The FDA is looking at changing this to a simple, not simple, but a basic ELISA type assay, where they've raised antibodies to the antigens, and then we'll do it in a sense of a 96-well plate and create a standard curve, which you can then again read your sample. But we've yet to see those come through. The FDA provides limits. So, for example, with the CBER, and by the way, CBER is the division of FDA that we work for. It's the Center of Biological Evaluation and Research that deals purely with these biological materials. And that's different from the CDER, which is the Center for Drug Evaluation and Research, which deals with the chemical pharmaceuticals. They provide us with a range in which the product needs to fall so that we can label it in a particular value. For example, cat, it falls between 10 and 19.9 units per mil, we can label it as 10,000 BAU. I'm not sure if I say this later, but we have to then submit this information to the FDA for every single lot we manufacture, because they have the final release on the product. So we have to wait for them to tell us it's okay. Then we can distribute it in the market. And usually it can take up to 30 or 60 days to get that response back from the FDA. We're trying to get that waived, but for the moment it's a requirement of the CFRs, which are the Bible basically that we have to work to. We do sometimes do some, although it's not part of routine testing, we will look at allergen compositions for immunoblotting and looking at the allergens, and certainly with complex allergens, where you see multiple allergens within the extract, just measuring a single allergen isn't necessarily a good approach to take. And the FDA recognizes this and came out with a gross ELISA type assay system. And they call this the CEDA ID50 EAL method. And basically what they do is take the standard, I think we're getting a bit late, so I'll go through this fairly quickly. They have a clinical procedure where they standardize this extract in the skin of patients by intradermal testing. And they can work out the concentration of allergen they need to give, on average, an erythema of about 50 millimeters. And so once they've found the concentration of that product that gives, on average, in a panel of sensitive patients to that allergen, the area of 50 millimeter erythema diameter, they will then label it in a potency. This is an example where they've generated a standard curve. They then read where the result is appearing at 50. This example is coming out round about 14.5 dilutions. They make a series of threefold dilutions, and they number them 1, 2, 3 all the way up. So it's taking somewhere between about 14.5 threefold dilutions to get to a concentration of this standard that's giving you 50 millimeter erythema diameter. They then look at these graphs that they've created, and if it falls between 13 and 15, they'll label it 100,000 BAU. These are the units that you're probably more familiar with. 10.9 to 12.9, it's 10,000. For us, we don't do this on every single batch, but what they then do is create a laboratory test, an ELISA inhibition test, out of that standard that they've calibrated. They'll provide us with the necessary reagents, and then we have to compare the activity of that standard with our product and show that they're equivalent. If they're equivalent, we can label them whatever they have on the standard, 100,000 or 10,000. And that basically is just running dilutions of the standard versus dilutions of the sample and seeing how close the two are together. And if they're on top of each other, they're like a perfect one correlation. They're 1 to 1. And we have a range, just like the RID, where if it falls, these ratios fall within a certain range, then we can label it a particular value. Here we've just got, and I should say to make this make sense, is what we do here is we couple the allergen to a plate, a plastic plate. We then add serum from a patient that they provide that would bind to the allergen on the plate. We then add our liquid allergen, which is the product of the reference, and that interferes with the binding. Then we can detect the amount of binding to the plate and create these curves. So if the two allergens, the reference and our product, are exactly the same, you get exactly the same profile coming out. And that's it. Did I make it in time?
That's a lot of work. What's the name of the yellow weed that grows on the side of the freeway here? Scotch broom.
Oh, yeah.
Yeah, so we used to test people with Scotch broom. Seems to be unique in this part of the country.
Right, it is.
Is it?
Well, I wouldn't say it's unique, but we certainly have a predominant quantity of it. The only trouble we've had with Scotch broom is a very heavy, sticky pollen. And there's been a lot of dispute about whether or not it truly gets into the air as an aeroallergen.
Yeah, that's what I wanted to
And
ask
it's extremely difficult to collect and clean. We used to, I don't think we produce it anymore, but we used to reject probably about 40 or 50% of our batches because we couldn't get it clean enough. It was so sticky, anything would stick to it. And we couldn't separate it from the contaminants. And we even resorted to chemical cleaning by putting it into solvents, but that's been frowned on more and more over the years from the FDA about introducing chemical contamination into our pollens. So eventually we discontinued the product, basically from frustration.
I think we stopped testing people because we just told them it was grass season and they would see the visible yellow flowers and be symptomatic, but it was the grass pollen that they didn't see that was causing their symptoms.
And that's usually the case.
Are any of these proteins to the point where you can sequence them synthetically?
Oh yes, a lot of them do.
So you don't have to collect the pollen anymore?
Yeah, and this is a path that's been explored a lot in Europe rather than the US at this point, but nothing's ever come to market at this stage. I think the trouble is that the upfront costs of developing that are so high when you look down the stream in terms of your potential revenue coming back from a business point of view. A lot of them don't make a lot of sense to do it that way. You'll never recover your costs on it. But it's an excellent way, and as things get rarer and more difficult to collect, I think I would predict ultimately in the end that's the only way to go, because as the problems with allergy increases, if immunotherapy becomes a much more, I won't say mainstream therapy, but if it starts being used a lot more than it is today, we're, as an industry, is going to run into problems in meeting that market. We have enough trouble with it at the moment with some of our allergens. So this is a possible way of going, ultimately. But for the moment today, the economics aren't there.
Everything
Is
you
there-
told, I'm sorry, go ahead.
Is there anything with pesticides? Do they co-localize to any of the pollens, or how do you get rid of them?
Pesticides are a potential issue, and that's why we prefer to collect from. Basically, we will screen sites where pollen is collected, particularly the fields, and we ensure that there's no pesticide application applied in the field or the entire environment around. So there's no chance of contamination. The trouble with a lot of these pesticides, the tests for them are very obscure, extremely expensive to run, and the ones we have done are a spot casing. We've never ever yet shown any presence of pesticides in a material, which confirms the way that we're collecting. It assures us that we feel a lot more confident that we're not inadvertently contaminating these materials. And sometimes it's also because we're actually collecting them from defined areas that we know a lot about the environment that's happening around, and certainly collecting from areas that have no culturing or field or farming type exercises going on, so we know there's no pesticides being used in those areas. Particularly weeds like sage-grass, for example. You can go out into the wilds and pick that and know that nobody is spraying it. That's why we avoid collecting from the side of highways, because you know that they're going along there and spraying those.
Everything you told us is basically true of both diagnostic testing material and immunotherapy material.
It's just the end finished product. It's just one goes into diagnostics or one goes into the treatment vials.
Have the issues with the AB dog gotten worked out now to the point that that's going to get standardized, or is that still?
Yeah, we're still waiting to hear from the FDA on that one. They have had it on their list to standardize, in my memory, for at least 10 to 15 years. But I'm not sure they've really got very far with it. But their intent was, anyway, to standardize it based on the CAN F1 level, that we control our products. Well, we don't control it, but we measure the value of CAN F1 in our batches.
And the other question is with the grasses, since they all cross-react, is there a real reason to have 8 grasses? Since I think we all use the 7 grass mix.
I'd say no. There's probably the only reason they had 2. Bermuda grass and one of the northern pasture grasses.
What about, I thought Johnson and Baha'i grasses were...
Yeah, but they're not standardized. They're basically the non-standardized weight volumes. But even there, you have, I remember, Bahia is cross-reactive with, it's just the one that goes with Bermuda, I think more. I think it's Bahia, or it might be Johnson. One of them is fairly well covered from the other. Bahia is one that's a little unique in itself. There are about 4 different major grass groups, and Bermuda and the northern grasses cover 2 of those groups, and the third one I think is either Bahia or Johnson. It is Johnson. is a member of. So that's the unique one. So there's sort of 3 unique ones, but only 2 of them are standardized.
Why doesn't ragweed grow west of the Cascades?
I don't really know.
You're asking all these questions like, why is there
I mean,
air?
we've been having fellows try and plant it for decades. I'm joking.
Must be something in the soil, I think.
Do you remember the Gary Larson cartoon about ragweed?
No.
It has a picture of it's 2 guys, one Johnny Appleseed and Irving Ragweed, and Irving Ragweed is planting ragweed all over, and Johnny Appleseed's planting apple trees. Gary Larson hates allergists. He's got some great cartoons about that.
Well, thank you very much. As I said, we take your product for granted, right? You just go to clinic and you got a bottle of stuff that you use. You have no idea how it got in that bottle.
Well, I hope it gives you a little bit more background and understanding. And I know we're always happy to see you guys coming out to the facility.
Well, the second-year fellows come over to see all of this and get a botany walk. Yeah.
Yeah, schedule.
Well, thank you very much.
Good rest of the day.
Thank you for coming.
No problem.
Now we got enough catering to feed the
In April, yeah, I'm really excited.
Either
Oh,
feast or
you
hand.
Right.
email me maybe. I think I did
So
at
you're
some
gonna
point.
get
Oh,
back
perfect.
I'll pack up.
Yeah.
Did the recording?
Yeah, I saw a date.
Are you guys meeting with him with Matt? Monday is Matt.
Yeah, and Jay's going too. Yeah. Do you, I haven't asked the group, but I signed my
Go over, like,
contract to start at
basic
the end of the
research.
year with the
Okay.
Constable.
I have
Do
clinic
you work with them?
They do. They buy
On Monday
Oh,
afternoon.
perfect, good.
Ladies,
You know, 'cause,
I'm sure I can.
I'm just starting to learn about the practice, but I'll be in Gig Harbor.
Oh, okay.
Predominantly Gig Harbor.
Yeah, talk
location,
about group.
but they told me that I think,
Yeah.
and I don't know the details,
So we were gonna
but
meet.
they don't use the merge channel.
Right,
Yeah.
so we can talk.
You can do the computer. That works too.
Yeah, that'd be great.
Same tip as
So I'll just want. It's not like
It's the same kind of,
Yeah.
Is that the one we use here?
I'll talk to you.
I got No, we have another one that we used to use that were individuals, and they have like a little plastic.
So that might be the same one.
trade off.
Yeah.
There's a lot of
Yes, and they always leave a tiny belt.
I think I was like talking to like around 3 o'clock.
Always there,
Yeah,
whereas
I mean, if
the
I-
other, the
it's in
multi-channels
one.
we use,
As long as I
here
leave
now,
the
don't do
inside
that.
part
And I was talking to Dr. Jacobs,
Yeah, so maybe,
just
yeah.
in passing when I interviewed, and he's like, yeah, it's something I'd always
Christina.
considered as like the multi-channel. And so
Oh,
maybe
yeah,
when I
but
get
I'll
there
ask
before I can look
Matt
into
before
it.
I don't know.
Because I think it, even if you do it singles, you know, with the kids, we have singles, you sell that same tip
Yeah,
as a
we
single
thinking
before,
go over
yeah.
kind of the,
their
way of feeling
Oh,
about
that'd be
Is
great.
it, oh, okay, yeah. Because you just go down, you don't have to like,
So it's
yeah.
like Dennis spoke to,
Alright, thanks, Bill.
pulmonologist doesn't think of his name right
Are
now.
you there, Rat? In that area? Okay. Okay, cool.
So
Yeah. That would be
But we're
great.
gonna be.
I just think like, and it's harder to get that like this is like
Mostly going to be
kids
associated
and to be like
with
even for and
So,
just fast, yes, and then with the foods too. Yeah, that would be awesome.
all I do is the
So it's,
Yeah.
and then, you know,
Just try it out.
we're able to.
Yeah, so maybe when I mean this is
We'll
like
make it.
not for like November, December, but maybe I'll email you when I get
And
an
then
email
we'll-
and stuff too.
Yeah.
That'll be
My
good.
understanding is Zoe will pick them up at the airport
Okay.
Yeah.
So I can set that
and
up.
Great.
take them briefly to
Yeah,
his hotel.
that's perfect.
Yeah.
Alright, thanks so much.
And then bring
We'll see you
them
again.
down here.
Take care.
He's going to have our
Thank you so
fellows,
much, that was great.
senior faculty present their research.
I'm glad that we had you.
Okay.
Someone's got a
Did you book your
well,
flight?
That's half
No,
the
no,
time.
yeah.
Just ran out really quickly. Grab your water, serious.
In the middle of the day?
Yeah.
pain in the ass.
Honey was part of it.
It was
Right.
Like those kind of things.
That's totally fine. We'll figure that out for sure.
Yeah.
Um,
Yeah.
yeah.
Yeah. Oh, no.
It's interesting.
Dr. Patel, you
I
figured out where you're going to
initially
go
asked
after?
for-
Yeah, I'm going to Kaiser in Southern California.
Are you really?
Yeah,
Very good.
I'll be down there.
All right.
So after like
Are you guys going to
5 months of waiting.
I'll be there.
Yeah, we'll be there.
You have to drop by the booth.
Yeah.
Andrew's
Half
coming.
of my ass.
Yeah, Andrew.
I just got.
Have you texted
Oh,
him?
Yeah.
We need to
Their
set
rep
up,
calls
like,
me
a
and says,
meeting
oh
with
good,
the
now we
internet.
can sponsor the dinner, and he's gonna give a
It's
lecture.
the first week of
So
June.
I said,
Charge, yeah, it's like,
Yeah.
You,
will we
you
leave?
fooled around so long.
Next week.
Let you know.
No.
Starts on Friday, right?
You want your money?
Next
Saturday
week,
morning?
a week from this Friday, yeah.
Did they take it?
No.
Yeah, I know, I'm like,
I just basically pissed off the guy.
Yeah.
yeah.
Well, it
And I
takes
said, you're probably gonna get,
time you don't really have to
Are you
wait.
flying out on, did you say you're flying out on Thursday or Friday?
I'm going out on
Thank you guys very
Thursday
much.
because I got that
We might be,
Oh, hi.
we're
Yeah.
flying out
Sorry,
Thursday as
sorry.
well to meet with Tom and Sam. We kind of have a little
Okay.
commercial meeting
Hello.
next to the meeting.
Get your story straight.
Yeah, very good. More connection.
Thank you very much.
I'll find her in a second.
Dr. Alden,
Okay.
can you sign
Yeah,
this?
I
It's
didn't
just
know
a
why I called
sign-in sheet
myself.
for.
I don't know who actually paid for
Sorry, very
this.
good to see you again.
Thank you.
Dennis.
Okay, very good, thanks.
Thank you very much.
Bye.
Where do I speak
Probably
about?
not, Dr.
Okay.
Anderson.
Oh,
We had
thank
to
you
run
for
pretty
being
simple,
patient
but-
with us this morning.
Oh, no problem at all. I know how that works. I know how
Well,
that
it's
works.
supposed to work better, that's not how it's supposed to work. But thank you very
No,
much.
well, I appreciate it.
Yeah, as I said, actually teaching, especially our fellows, I mean, we just open a file and
Yeah, it's
have
there.
no idea what you
Well,
guys did to get it
to
in
be
there.
honest, that's what you should do. You shouldn't be worried about everything that's coming up.
All right, well, each generation of fellows, we need to have you, I can't be doing this too many more years, someone's gonna take over, but we'll continue to have you over like you do.
Very good.
Thanks again.
Okay, take care. Bye-bye.
I signed because I'm in the same company, but
Huh?
you can sign. And so yes, so next Tuesday I will try to stop by and see you if you have a minute. That'd be greatly appreciated.
Well, I may have my calendar with me.
Okay.
The other thing is, we need to go back and make a couple of edits
Yep.
on, you can throw that in there if you want, I'll carry this bag out.
Your copy.